About chronic leukemias. In chronic leukemia, we have the first is the chronic lymphocytic leukemia. Now you see lymphocytic, it means it's mature. So in chronic lymphocytic leukemia, there is going to be increased proliferation of naive B cells. What does that mean? Naive B cells mean that they are morphologically mature but functionally incompetent. So CD5 and CD10 are the types of B cells. Sorry, CD20. Okay, there is going to be increased lymphocytes and increased smudge cells. Important, you need to know this. And of course, lymph nodes are going to be involved. If they involve, then it is called a small lymphocytic lymphoma. Of course, it is going to form a mass, and when there is a mass, it is called as a lymphoma. And if it becomes a small lymphocytic lymphoma, it is then going to progress to diffuse large B-cell lymphoma, which I'm also going to talk about in the lymphomas video. And that phenomenon is called as Richter's transformation, and it presents as enlarging lymph node or enlarging spleen, called as splenomegaly. So what is the prognosis of CLL? It is from stage 0 to 4. Stage 0 is only lymphocytosis, increase in lymphocytes, and stage 1 is lymphocytosis plus lymphoadenopathy, and stage 2 is lymphocytosis and hepatosplenomegaly, stage 3 is anemia, and then stage 4 is thrombocytopenia. Complications include hypogammaglobulinemia, because of course it's a CLL, B cells increase, but plasma cells decrease. So there is going to be decrease in antibodies, and antibodies are basically gamma globulins, and of course we're going to have hypoglobulinemia. And of course autoimmune hemolytic anemia can also occur, and DLBCL. Next is chronic myeloid leukemia. Important thing to notice here that chronic myeloid leukemia is also considered a myeloproliferative disorder. So you can, there is of course overlap between that category and this category of leukemia. So what is going to increase? Myeloid cells are going to increase, and mostly granulocytes, and very commonly basophils. That is important. In chronic myeloid leukemia, you're going to have a lot of basophils. So where is the problem? Mature myeloid cells. Basophils. Very much basophils. And of course granulocytes that make these basophils. Patients are usually 40 to 60 years old, and risk factors are radiations, and of course it is going to lead to splenomegaly. And now we talk about Philadelphia chromosome. That is 922, and it is a proto-oncogene called as ABL. What actually happens is that on chromosome 9 we have ABL gene, and on chromosome 22 we have BCR gene. Because of reciprocal translocation, we have a BCR ABL fusion gene, which is now called as a chromosome 22 post-translocation. This chromosome is now called as Philadelphia chromosome because it was discovered in Philadelphia. So if this is present in CML, it has good prognosis. But if you find a Philadelphia chromosome in case of ALL, it is bad prognosis. Now CML is a chronic myeloid leukemia. It can progress to AML in 2/3 cases, or it can also progress to ALL in 1/3 cases. Now important thing is to differentiate between CML and leukemoid reaction. Now CML has a lab score. It has negative lab score. It is basically leukocytic alkaline phosphatase, and it is negative in case of CML, but it is positive in case of leukemoid reaction. In CML you're going to have basophilia because it's cancer, but in leukemoid reaction you have no basophilia. There is going to be Philadelphia chromosome in CML, but there is going to be no Philadelphia chromosome in leukemoid reaction. Next is hairy cell leukemia. In hairy cell leukemia, there is increased mature B cells, but the important is that it has hairy cytoplasmic processes, and they are TRAP positive. TRAP is just a tartrate resistant acid phosphatase. That's an enzyme. It is a rare and settle form and mostly occurs in middle-aged patients. It accumulates in red pulp of the spleen. That is important. So what it's going to cause? It is going to cause splenomegaly. And it also causes marrow fibrosis, reticular fibrosis, that is. So whenever you do bone marrow aspiration, you're going to have a dry tap. And of course, there is no lymphadenopathy. And that is it for chronic leukemias.